Welcome to 6ABC's Weekend Extra, paid for by Mainline Health. Here's Jessica Boynton.
If you've ever struggled with your weight, well, you're definitely not alone. More than a third of adults in the United States are considered overweight or obese, which makes it one of the most common health concerns in our nation. We know some of the health risks that are associated with being overweight, but what should we expect when we actually lose it all? On today's 6ABC Weekend Extra, we are chatting with Dr. Samantha Witte. She specializes in bariatric surgery at Mainline Health's Bryn Hospital. Dr. Witte, thank you so much for joining us today.
Thanks for having me.
Yeah, so you're the expert, so we're gonna ask you a bunch of stuff about this today. Why do you think it's so difficult to lose weight and actually keep it off? That's the burning question.
Well, so weight loss is one of these all-consuming things, and it's not just about diet and exercise. It's a true lifestyle change and a lifelong process. And so very often people come to us and they've struggled with weight loss for their entire lives. They've yo-yo dieted. And some people have genetic problems that they have to overcome. Some people have medical issues that are secondary to their weight that make it harder for them to lose weight. And some people just have bad habits that they've built up over a lifetime and they aren't broken overnight.
So how does being overweight or living with obesity actually put our health at risk, whether it be short term or long term?
So patients with obesity or who are overweight have increased risk of many medical conditions that are very common in the United States. These include cardiovascular disease, diabetes, high blood pressure. We also know that patients who have obesity are at increased risk for certain types of cancer even. And if you develop those cancers, we know that patients who have underlying weight issues do have worse outcomes from that cancer than a non-overweight counterpart.
Wow, so that's interesting. So when should someone actually consider weight loss surgery, and how does it actually work once they get there?
So weight loss surgery is a great option for a lot of people. And so in some cases, we have patients who come to us who have struggled with their weight for their entire lives. And some people are still young and they want to get ahead of it before they develop these medical conditions. For the most part, we look at BMI, which is a mathematical calculation that we do based on your height and weight. And over a certain BMI, a BMI of 40, just about everyone would qualify for bariatric surgery. And over 35, over a BMI of 35, patients with certain medical comorbidities. We are very well-organized multidisciplinary program, so it's not just surgery, because we really believe that surgery is a tool to help people lose weight. The principles of bariatric surgery are restriction, malabsorption, and actually changing the gut hormone levels that promote satiety and hunger in patients. So unlike dieting, where you feel like you're starving yourself and you're telling your body that you're starving yourself, so you're increasingly hungrier all the time, patients who have bariatric surgery actually have appetite suppression. So in addition to feeling full sooner from the restrictive component, they're not as hungry, and so they lose weight that way as well.
Wow, it's like tricking your body a little bit.
So we can change the body's set point for weight by changing these gut hormone levels.
So when should someone consider weight loss surgery, and how does it actually work?
So most of the patients who come to us have had struggles with their weight for many years, but some also come before they have lots of medical problems related to weight because they see them in their parents and they want to prevent that outcome for themselves. In general, bariatric surgery works on three principles. Restriction, meaning you feel full faster. Malabsorption, meaning you don't absorb all the calories that you eat. And also a change in your gut hormone levels so that you just don't feel hungry as often compared to how you are before surgery. And I think that's the thing that makes bariatric surgery really unique compared to diet and exercise, where when you diet, you tend to be hungry all the time because your body thinks that it's not getting enough based on those hormone levels. And after surgery, there's a flip so that you feel full and your brain thinks, yes, I am full, I have enough.
6ABC and Mainline Health are proud partners of Well Ahead Philly. To learn more, you can go to wellaheadphilly.com. Thanks so much for watching. Stay safe and healthy.
Well Ahead Philly helps you gain access to the information you need to feel better and live well every day. Thanks for watching 6ABC's Weekend Extra, paid for by Mainline Health.